Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. The patient in this procedure is a regular client of mine. They attend approximately twice a year to have their right ear cleared of a buildup of earwax and dead skin, as you can see. So it's not all earwax, there's also a lot of dead keratin. It's very seldom that we need to perform any procedure in the left ear, so the left ear is quite self-cleansing, it's just their right ear. What's really interesting about this client is their eardrum anatomy and their middle ear anatomy, and if you keep watching at the end, I'm going to have a still image of the patient's eardrum, and I'm going to discuss certain parts of their anatomy, and I've circled certain areas so it becomes evident to yourselves. So at the moment I'm just using a standard Zollner suction probe. So a standard Zollner suction probe in length is about 8 centimeters from the handle to the distal end, the tip. Around 3 centimeters away from the tip, there's a 30-degree angulation, so it's bent at 30 degrees, and that bend actually helps navigate some of the bends in the ear. So the ear has two bends. The first bend is around, I'd say, half a centimetre into the ear canal, and the second bend is approximately a centimetre in, and that gives the ear its unique S-shaped bend of the ear canal, and that S-shaped meander, if you like, is an evolutionary trait advantage to protect the eardrum. So if you have an object that enters the ear, it has to serve as a sharp object, for example, it'll need to mitigate two bends before it can get anywhere near the eardrum and potentially perforate it. So I'm just gently removing this dry, crumbly wax keratin off the ear canal. I'm just gently peeling it, as you can see, and I'm extracting it forwards, laterally out of the ear canal. I think I'm going to use a fine end gauge now to remove some of this remnant dead skin. So this is not occluding the ear, it's not going to improve the patient's hearing at all, but because the patient does get quite a frequent buildup of dead keratin and wax, I'm just trying to peel away as much as I can. This keratin, dead skin, it's quite fresh, it's quite stubborn still, it's still quite tightly adhered to the bony part of the ear canal. And you can kind of tell by the colour of it, it's quite white, so which means it's more of a fresher layer. So the outermost, so this layer of skin that lines the bony part of the ear canal, it's kind of 5 layers thick, and the outermost layer is generally dead skin. It's lost its metabolic function, its intracellular activity, and you just get a buildup of keratin, which is a protein found on our hairs, nails. But this is still quite a fresher outer layer. So you can see this keratin here, more lateral near the entrance, it's oxidized, it's turned into a brown colour. So this is an older piece of dead skin, so it's a bit easier to remove. So just using a fine end gauge just to remove this. And you'll see in a moment the patient's eardrum. And it's a really interesting eardrum actually. I'll just let you watch the remaining bit of this procedure. So with dead keratin, it's not always possible to remove every little last speck. Sometimes it's quite tightly adhered. We leave that. You then run the risk of cutting into the ear canal, causing trauma, pain, possible infection. So there's always a fine line. Okay, so there we have it. That's the patient's eardrum. And you can see the front part, the anterior part on the right hand side, that's all white, so we call that tympanosclerosis. You can see I've labelled that there. So tympanosclerosis typically occurs secondary to some form of trauma to the eardrum, whether it be barotrauma, so change in pressure, physical trauma, acoustic trauma. This part of the eardrum is the umbo. So that bone is the hammer bone, also known as the malleus, and that was the umbo. This is the handle of the hammer bone, handle of malleus, and we call that the manubrium. And then at the top, we call that either the lateral process or the short process of the malleus, the hammer bones. It's the bit at the top that sticks towards this. And that's the posterior process of the handle of malleus. So the malleus is known more commonly as the hammer bone. And now this is the head of the stay-piece, or the stirrup. Now there should be another bone in between the malleus and the stay-piece called the incus or the anvil, but that's been eroded, and that's been eroded because this patient's posterior part of the eardrum, the part I've labelled here, it's been retracted. It's sucked in. And when it's sucked in, it's draped over the anvil, the incus, and eventually eroded it. So it's quite a severe retraction pocket, and that occurs due to eustachian tube dysfunction, which is another topic completely. But if you keep watching, and I have talked about the eustachian tube a number of times. Well, I hope you enjoyed that video, guys, and that brief explanation of the anatomy of the eardrum and middle ear. That's very simplified. There's a lot more we can talk about. But if you do watch one of my videos, you will see I do cover bits and bobs and all of them. Well, enjoy your evening, guys. Take care. Bye.